Karen Reddy-Medeiros, one of the 3 co-founders of the Pro Safety Beauty Summit, an industry relations specialist with KRM Product Seating. The purpose of this summit is to build a community that delivers the most up-to-date safety products, protocols, and education tailored to the unique needs of the beauty industry straight from the experts. As we were doing research and preparing for the summit, one of my partners, Madeline Leonard, shared a press release for a Canadian-based company making antimicrobial masks. I did some research into Triomed and placed an order online. Soon after, I became connected with Pierre-Jean Messier, Executive Chairman of i3 Biomedical and Triomed Innovations Europe. Pierre-Jean graciously agreed to present today in order to share his experience and insight into the topic of masks. Pierre-Jean has devoted 3.5 decades as a researcher and product development specialist in the biomedical, microbiology, and hemodialysis fields with a focus on infectious disease transmission and remediation. It's almost as if he's been training his whole life for this pandemic. For more than 15 years, Pierre-Jean provided expertise as a scientific principal investigator and chief researcher to both the Canadian and the US Departments of Defense. Pierre-Jean is going to talk to us about masks, a fairly new topic for most of us since March 2020, and sometimes a contentious topic. He will help clear up confusion, and upon ending, the goal is that each of us will have a better understanding and the ability to walk into a drugstore or pharmacy anywhere in the world and be knowledgeable about choosing the right mask for our needs in a close contact environment, such as working in touch services. Welcome, Pierre-Jean, and congratulations to you and the Triomed team on recently receiving the gold medal for the most significant impact on Canada's personal protective equipment at the Canadian Industry Leadership Honor Awards. I'll let you take it from here.
Thank you very much for having us today. It's much appreciated. As Karen mentioned, I'm going to try to make some sense out of this confusing lands of masks and respirators. There's a lot of things happening out there, a lot of reporting taking place. And for most of us in the general public, we just don't know what masks really are all about. So it gets to be very confusing to know exactly what is it that we should utilize, what is it that we should wear, when do we protect oneself, when do we protect others, and that's really what we need to do right now. So let's start with a little bit of history. The first is mask and face covering started more than 2,000 years ago, but that was for SANS and otherwise. But in specifically sickness control, let's go back to the 14th and 17th century with the bubonic plague. And if you see the picture of that, they were actually called Dr. Plagues, and they had this long beak mask that was there. These masks were the very, very first ones. They were utilized not really to filter anything, but really to, they contain some juniper and other aromatic plants. So to minimize the bad smells of the areas these individuals work in. It so happens, since they kept on being able to go from villages to cater to patients, it happens that it was filtering something in a primitive kind of way. Then we jump to 1861. The scientist Louis Pasteur from France discovered in that bacteria, not viruses, which is the case of what we're attending to now, bacteria could actually transfer by breathing. So he was the instigator of utilizing a cloth mask, and we're going all the way back to 1861. Then we jump to 1905 in the hospitals in Chicago, where we have, at that time, the realization that nurses and doctors in surgery at that time would need to have a face covering to have a better hygiene during surgery. So Chicago, 1905, again, cloth mask. Then unfortunately, the global flu hit, and that was a very, very difficult time for humans. But we did see, as we're seeing now in some countries, we did see that masks were an obligation, a regulated obligation to be worn in public transportation and also in public places and workplaces. So 1918, 2020, having to put masks in a general sense in the public for individuals like us that don't normally wear masks we're not actually reinventing anything. It's something that took place close to a century ago. And then 2020, you've got advanced technologies. I'd like to put a point forth that we've been having cloth masks that was really the only thing that existed. But for the last 100 years, phenomenal technologies by different countries, different corporations have been developed to make masks and respirators perform in many different ways that are extremely important to understand to properly protect yourself when you are in the public or with your clients. Let's go to what is a mask? What does it do? What is it supposed to do? Well, there's two aspects to the mask. You want to be protected from the outside, and the outside wants to be protected from you. So you've got two completely different perspectives that are entailed here. So the first thing that is very important is your mask is a filter. It needs to protect you when you're breathing from having bacteria or viruses to come through the mask and basically enter your airway. And then the other side, if you are potentially sick and you would be coughing and breathing, because you don't need to just cough to create infection. If you're breathing out viruses, which is the way that viruses go back into the environment, you need to have something that filters also virus and bacteria going both ways. So, point very important, filtration capacity. Particulates travel in air when you're coughing. So that's easy to see because it looks like spittle or very small water droplets. But actually, you can increase your microscope and you will see that very, very small fluid particulates contain viruses and bacteria actually exhale when you breathe out. And those will travel in air, stay suspended in air, deposit themselves on different things, or somebody can breathe those. So the capacity for a mask, from a technological standpoint, to protect you from and the others from you, to be stopping these micro droplets, and is extremely, extremely important, especially with COVID-19 or Corona SARS-2. A mask must be worn for a long time, so it has to be comfortable. So comfortable means that it's not going to be irritating, itching, it's not going to be warm. It's an extremely important aspect. If you keep on touching the mask, repositioning the mask, removing the mask, then it's not going to do the job. So comfort, while it looks like a detail, is extremely important to be able to wear it for a long time. You must have something that will fit properly around your nose and your mouth. It means that mask needs to have a nice fit. If you have huge gaps between the mask and the skin of your face, then when you exhale or breathe in, the air will prefer to go through that air gap. And so it will not be filtered, or it will not stop anything from coming in or out. Very, very importantly, if a mask is not worn appropriately, then it's not going to do anything. I mean, we see a lot of people wearing masks on their mouth, but not covering their nose. I've seen masks on chins, on heads, in pockets. I've seen masks in just about every possible position on the face. There's only one that works, and that's when it covers properly your nose and your mouth in a comfortable way. So those are important parameters. So that's what you want to retain for a mask performance, what it is supposed to be doing for both you and the people around you. So let's talk with the first types of masks, which are respirators. Respirators are different than medical masks. So now we're going to focus to start with what a respirator. In the United States, these will be known under the general name N95s. In Europe, they'll be known under the FFP families. There are regulated devices. So these masks are submitted to important testings for breathability, filtration capacity, capacity to stop fluids from penetrating. So very importantly, these are regulated devices. In the United States, in the Americas in general, the NIOSH for N95 or N99 or N100s are different ratings. So N95 is a general device that can be found. N99 is going to filter more particulates, so 95% for the N95, 99% for the N99, and 100% or very close to for the N100. The higher the number, the higher the filtration capacity. FFP2s are what is found in Europe. These testings are very, very similar. And in that category, they're called FFP1, which is your lowest protection level, FFP2, which would be somewhat similar to the N95 protection level, and FFP3, which is in the same category as an N100 in the United States. So when you're going and you want to have a protection level, which is from a PPE, protection devices, then you need to go and you need to look for a device that's going to have on its packaging, on the mask by itself, the actual rating. These devices, as I said, are regulated. So you can't go into the market unless you have tested extensively. You have to meet all the tests. And these tests are registered, and you're actually registered at either the CDC, NIOSH in the United States or the equivalent in Europe. The advantages are that you have a better fit on the face than another type of mask. Now be careful. Believing that an N95 is a perfect fit on any faces is erroneous, it's wrong. A good example is that when a doctor and nurses will be fitted, that means we need to find what is the best mask for his type of face. There's a specific test that's done. We will utilize different types of masks to find the right model for that person. So while an N95 or an FFP2 family has a better fit than other devices, they're not perfect. So you need to, when you acquire or take one of these devices, you need to make sure that the fit, which is basically the contact of the mask all around the mask on your skin, must be as close to perfect. This is the only way to ensure that you will have the air always going through the mask. The disadvantages is they're more difficult to breathe normally because they have a high resistance. So you could get tired by using them for a lengthy period of time. The standards allow for higher level of resistance when you breathe. So that's more demanding. And the other thing is that, well, they're more expensive, okay? An N95 or an FFP family respirator that has a valve on it, you've seen those, is to help you when you exhale. So it doesn't get warm and you basically are able to have a breathability, which is easier. But that protects you. If you have a mask that has a valve, you're not protecting the environment. For example, if you potentially are infected, every time you exhale, that valve will open. And when you cough or breathe, it's going to go back into the environment. So just to keep in mind that when you wear a mask of that category with a valve, you protect yourself, but absolutely not the others around you. These masks, like any other mask, are by regulation for single usage. That's the regulation that we have right now. Let's go to the next family. The famous masks, the face mask, the medical mask. There's a lot of these out there. So in the Americas, you need to look for one of three categories. It's ASTM, level 1, 2, or 3. Again, similar. The higher the number, the better the filtration, the better quality of the mask, and the better protection level that you will have. In Europe, it's class 1, 1R, 2, and 2R. It's very similar. The higher the number, the higher the rating, the better the mask. The price will slightly be higher, but these again are highly regulated. You need to pass a lot of different tests. You actually have to test that it filters bacteria, in some cases viruses. One of the very difficult tests for these masks is that those famous small droplets or fluids that can travel in the airstream when you either breathe or cough. These are tested extensively against that because that's a protection level that you need to have. And so in the Americas, an ASTM level 3 will have the highest, the most demanding test, a very tough test, so that any fluids, micro droplets or otherwise, they will try to go through the mask and across the mask so that you could breathe it in, will be stopped. In Europe, you're looking for a class 2R that's going to have the same testing requirements, and that's where you're going to have the highest protection. So you got filtration capacity, and you have a very high resistance for micro droplets, for somebody coughing or somebody sick is breathing out or exhaling. that it will not come in and contaminate you. Both of these types of masks are regulated. So again, these are masks that you look for that have a standards, testing requirements done by third-party laboratories, complex quality control, very high technology that is inherently built into those. But they're confusing. They're confusing because they all look alike. So I'll take 3 masks here. You got a blue one, you got a pink one, and you got a yellow one. The color is irrelevant. They all look alike, same size, same shape, but they're not the same price, and they're not the same category. The blue one here is not even the lowest level of standard. It's called a procedure mask. It's not an ASTM. It's not ASTM 1 or 2 or 3. It's not even part of that category. It's not regulated, but it's confusing because it looks like the same, okay? These two, they look the same also, except for the color. Well, that's an ASTM 2, and this one's an ASTM 3. The protection level, as we mentioned, of this one, ASTM 2, both in filtration and in breathability, having fluids that will penetrate the mask, is completely different. So what is difficult when you choose your mask, your face mask of this type, is that they all look the same. The prices can somewhat be confusing also because you can have some very low quality masks that are not even regulated that look exactly the same and they're the same price, despite not having at all the same detectance and protection level that you have. So one of the biggest problems that you probably had, and a lot of people do, is to how do I make the difference? So we'll go into what you're looking for at the end. But you need to understand that the technology that are built inside these masks to give you that kind of protection, category 3 for STMs in America, category 2R in Europe, okay, those are high standard. To get that kind of protection, what's inside the mask and the test requirements not at all the same. So I took a category 3 mask here and I've opened it with a pair of scissors. So you've got your outside layer, which is very important, okay, in some regards for protection against fluids and other materials. You got your inside layer, which is very important for the comfort against the skin, no irritation. Again, all these materials are tested independently under all kinds of different testing. But the main part is the centerpiece, which is this one, okay? The centerpiece is like the engine of your car. That's the material that will make the mask easy to breathe or not, that will give you the filtration capacity of a level 3, a level 2, a level 1, or no level at all. And also will protect you against fluid particles that will fly around the environment and try to get across the mask. Now, if you take the blue mask here that I showed you, which is not even regulated, the material inside doesn't do anything. You can see through it. It doesn't filter anything. It doesn't stop anything. Obviously, that engine is a very small engine if you want to compare it to a car. So the price of that device as a manufacturing is extremely low, okay? But if you go to all the way to a category 3 or all the way to a class 2R in Europe, the material that you have to put inside to be able to pass all these tests is extremely expensive. The technologies are electrostatic technologies. They've been developed in the course of the last 100 years, I would say more like 50, 60 years, always getting better because the requirements to make these devices better performing and to provide the better protection has been ongoing as a nonstop technological advancement in the last 60 years. So if we go back to medical masks, confusing because they all look the same, but now we're seeing that they're completely different. They're not the same when the way they're built. They're not the same the way to protect you or the others that are wearing it. Both types are regulated in Europe or they're regulated in the Americas. There's a substantial amount of testing that are required in both geographies. And to be a 2 or to be a 1 or to be a category 3 in the United States, the testing is not at all the same thing. For example, a category 2 mask will not pass the requirements of a category 3 mask. That means that your protection level is that much more enhanced. So very importantly, they're regulated. Keep in mind that a procedure mask, like the one I showed you, and forget about the color is just confusing, it's irrelevant, is not regulated. It's neither of any of the regulations that I mentioned. That means that you basically have an unknown protection level. Basically, you don't have a protection level. The advantages of these masks is that they're extremely comfortable. They're by definition easy to breathe. You can wear them for a long period of time. You don't get hot into them. Because of what's happening out there right now, we have to go out and wear a mask for a lengthy period of time, or if you're practicing your profession, then you have to wear a mask for a lengthy period of time. You need to have something which is comfortable to be wearing. The disadvantages is that they don't have a perfect fit. As being said, no mask has a perfect fit, actually. The respirators don't have a better fit, but perfection is not that. So one of the disadvantages that we can see with those rectangular masks is that the fit is not perfect. So again, it goes into the same thing. Adjust the mask properly with the nose clip. Make sure that the ear loops around your ears have the right tension, and position the mask on your face so that you have the very best coverage possible. Again, very importantly, by rules and regulations, masks are single use. Keep in mind that the outside surface of any mask will get contaminated by different types of microbes. So when you remove the mask, do not touch the outside of the mask. Limit yourself to using the ear loops, which is the reason why, by rules and regulations, all masks are single use and all respirators are single use. Now let's go to the more confusing land. Now we're going to talk about the other mask. Now there's a lot of them out there. Textile masks, fashion masks. You even have a picture here of this mask, which is non-regulated, and there are many of these masks out there. So keep in mind that these masks are not regulated. They don't have to pass any tests, which is by definition not a good thing. It means you don't have any idea and perspective on the protection that you're getting. They're enticing because they can be more comfortable in some ways, in some cases, not all. Some of them are very difficult to breathe through, but not all of them. They're more elegant in a way. Famously, they're washable as long as you do wash them. So they still would be a single use. You would need to wash them, and preferably with a biocide or chlorine, for example, when you wash them with soap. But you don't have any idea, or nobody does have any idea, of the protection level that you have. Now, if you go back to the original slide, we're going back to basically to 1850, 1861 with Louis Pasteur. That's quite a while back. And that's quite a while back where we had the first real mask that was used. They were made of cotton or wool or combination. Then Chicago, 1905, the large pandemic flu of 1918. That's the only thing we had as humans. We had cloth masks. That's all we had. But between 1918 and now, about 100 years, the advancement in technology that I mentioned, done by all the companies in the world, and the different ways to approach protection, has been enhanced importantly. In 1918, you didn't have regulations on masks. Now you do. In all the countries, you got rules, you got regulations, you got testing that needs to be done, standards. This is a medical device, it's a very serious business. So that you actually can rely on these to know that you've got a device when it's regulated, you have a device that will perform as per the way it's supposed to be. The problem with the mask that we're looking at, the others, is that you don't know that. So I would just put a word of caution that if you're going to be in close vicinity of your, while you're working with your family in the public place, I would really emphasize the point that it would be preferable to have a regulated mask so that you know that you're protected and you don't have to be worried about it. So the whole purpose of this presentation, and again, thanks for the Pro Safety Group for having us here, is quite simple. My goal was to talk to all of you, and we've been doing this here for 35 years in the medical business, and mask and wound management and infection disease. And we do recognize that these are very confusing times. And there's so many masks out there and a lot of marketing. And at the end, one just gets very confused if you don't have the knowledge of all these 35 years to be able to make sense out of all this. So my single one goal here was to hopefully be able to give you the tools so that you can make the right selection and knowingly for you to have a clear perspective of what is the protection level that you have and what is it you look for when you buy a mask. So let's go into that aspect. What do you look for in a mask? When you're buying a mask, when you're looking for a mask, you're looking for a mask that is regulated. We talked about it's two types, either respirators or it's going to be medical masks, okay? Those rectangular masks we discussed. You're looking for a mask that will have the N95, 99, and 100 on it, stamped on it, stamp on the mask, stamp on the box, stamp on the packaging by a reputable company. Or in Europe, you will be looking for a rating that will be also stamped with FFP2, FFP1, FFP3. Always keep in mind, the highest the number, the highest level of protection. So if you're looking for a respirator, and we discussed that they were more expensive, they have a better fit. You're looking for a product that will have on the mask, that will have on its packaging a marking. You're only allowed to put these markings if you've been authorized by government. That's the rules. And that means that you will have passed the tests that are required. If you're looking for a mask, a rectangular medical mask, it's a different type. You're absolutely looking for a stamp on the box by a reputable company that will have ASTM 2, ASTM level 3, ASTM level 1. Or in Europe, that you will have level 2R, 2, 1R, or 1. Again, level 3 in the Americas for an ASTM level 3 is the highest possible level you can have. And 2R in Europe is the highest level you can get. When you do that, and when you see that marking, to be again allowed to do so, you need to pass, the manufacturers needs to pass extensive testing in third-party labs following science protocols that have been established by governments and scientific group. You just don't invent yourself with that kind of mask. And only when you have fulfilled all these requirements and you are a real medical manufacturer registered at your government, can you put this on your mask. So when you're looking for a mask that will provide you a level of comfort and protection for you, your family, either from the perspective you're breathing, you want to be protected, or you want to protect the others, I strongly recommend that you base yourself on the markings you will find on the boxes, because these markings can only be applied if you meet all the standards, you've done all the tests, and you're properly registered at government. Remember that the best mask in the world is not worn properly, it's not going to do anything. So if you're going to put a mask on, then you need to place it properly. Again, the nose clip, the ear loops, positioning it around the face, making sure that you have the best fit possible. That's very, very important that you take care when you put the mask on, that it really protects you. Lastly, but not the least, especially in the categories of medical masks, they all look alike. They all look alike, but they're completely different. But there's a way for you to know the level of protection that you will get, and that's by referring yourself on the markings on the box. I really hope that this small presentation will have enabled you to now go out, and when you acquire a medical mask or a respirator, that you will feel confident that when you select the one that you want, you will know very, very clearly the level of protection that you're getting, and you'll feel at ease that you're duly protected. Thank you all.
You broke this topic down in a way that we can all relate to it. Thank you very much for doing that, Pierre-Jean. Very informative presentation, and I learned a lot. It took me back to my science class. I haven't heard Louis Pasteur's name in years. And thank you everyone for attending this session. Please be sure to check out all of our presentations and their topics. If you can't make one, consider getting an all access pass, which will allow you to watch all of them at your leisure.